I can say that obesity is what I enjoy the most to treat. Health is an important subject in our lives. Obesity is declared as a disease by us, however, it is not a situation with a developed awareness in the community. I am Dr. Görkem. I am a general surgeon. But I am interested in the treatment of obesity for almost 10 years. And also I am interested in the treatment of metabolic diseases such as diabetes, blood pressure caused by obesity. Especially surgical treatment is our specialty. But we also serve our patients non-surgical treatment methods. For the patients who meet certain criteria, surgical treatment is the most successful treatment. Thus we have obesity surgery procedures. We have sleeve gastrectomy, which is the most applied surgery in the world. And we have gastric bypass surgery. And we have revision surgery treatment options for the patients who previously had obesity surgeries and resulted in failure, and asks for a new surgery, if the criteria is met. These are our surgical treatment services. Apart from these, we have non-surgical treatment options for those who are not suitable for operation or do not ask for a surgery. These are primarily gastric balloon procedures, gastric Botox procedures, and medical treatment options. And we also have 3 dietitians in our team. Obesity is a disease hard to overcome. It is not possible to have successful results with only surgical or non-surgical treatments. Our dietitians provide dietetics after the procedures within the program in the life-changing programs. Obesity is a serious health issue. All around the world and our country, 1 in 3 people has this problem, so this is a serious issue. This has started to be an economic problem aside from a health problem, especially for the budget of countries. Thus, the count of surgeries is increasing day by day. Our country is well experienced on this subject. Our services continue successfully to provide service on obesity treatment, especially for European patients. Generally, obesity is actually the problem of this era. We need to take this problem more serious and work on it. And not only surgery, we are to prevent this issue before the problem occurs. Health tourism is a subject we take too seriously. The quality of health services is at the top level considering Europe. Our physicians are really experienced on this subject. So as clinic, we think of health tourism seriously. We have fulfilled our liabilities against law, we have authorization certificate. And we are now advertising for international means. We aim to reach more patients from Europe and all around the world each day by advertising. We are trying to increase our service quality each day. With sleeve gastrectomy, 75% of the stomach is being shrinked, and hormonal factors come into prominence, so the patient loses weight with inevitable success. Gastric bypass surgeries are also very popular among weight loss methods. It is a really good surgical option for obesity treatment, however the operation rate goes lower as its revisions are a little bit hard. In bypass surgery, the stomach is being shrunk. But this time, some part of the bowel is being shortened, being passed, and malabsorption is created and the obesity is treated. These surgical options are just starters. After obesity surgeries, the things such as diet, lifestyle that the patient can't do before, come to life by itself. If the person likes this system, they can live a healthy and long life with ideal weight. Thus, no matter of the drawbacks, obesity surgery is getting safer day by day with the development of experience and technology, and gets preferred by more people. At this point, our clinic performs all obesity surgeries safely and it is successful at post-op follow-ups. We wish to be heard in all the world, not only in Ankara or Europe. Our country is really successive on this subject. I can say that we pull the weight from Europe. And the quality and care of our doctors come through. And I am sure we will be at better terms by time. We have non-surgical solutions apart from surgical solutions. The most effective one is gastric balloons. We are able to perform all gastric balloon procedures as clinic. We have endoscopy-free solutions and endoscopy-applied solutions. For health tourism, we mostly provide ingestible gastric balloons that doesn't require revisit of the patient or endoscopy to foreign patients. And we are able to have good results in this method, however not as much as surgery. Maybe I am repeating myself at this point, but follow-up is really important. Our clinic continues follow-ups with 3 dietitians. The key to our success is actually follow-up. Of course the implementations are made safely under my control as the doctor, however. For follow-up, a team is needed. The more experienced and devoted the team is, the more successful results are taken. As a result, we are proceeding to be a clinic that takes obesity serious in Turkey. Obesity surgery is being commonly performed in our country. For an institution to perform obesity surgeries, the hospital and the doctor shall have certain criteria and equipment. At this point, in the hospitals we perform surgeries, a class intensive care units are must-have. And in case of a complication, doctors in the field such as endocrine, internal diseases, gastronomic and intensive care should be there. We pay attention to these criteria for the hospitals we are performing the surgeries. And for a surgeon to perform obesity surgeries, they should have a certain equipment. Alongside of acquiring the abilities to perform the surgery technically, they need to have certain experience to be able to manage the follow-ups at the post-op. And there is a new regulation of the Ministry of Health on this subject. We applied to Ministry of Health saying that we meet the criteria of this regulation. Obesity surgery seems to be an easy procedure. However, on the contrary, it is a really hard procedure. Starting from pre-op briefing, post-op, feeding, follow-up, etc., it has many features. Thus, the doctors, including me, interested in surgical treatment of obesity need to focus on here, leaving all other works aside. This way, I believe that more flawless, more successful, more long life and sustainable service and treatment can be provided. I can say that I dedicated my last 10 years to the surgical treatment of obesity. Our country takes firm steps forward at the health tourism. There is of course some step backs, and I think these should be corrected. A certain standard shall be met. Health facilities that provide these procedures shall be constantly inspected in the stage of some criteria. And it is already being made by related institutions. However, when compete starts for the price, service quality may be conceded. We may need to look into mirror. For this service to be given at a certain quality, certain amount of costs shall be considered. If the companies compete with each other to lower these costs, it will create more problems. I think we need to be attentive about the costs, and we shall not tighten up each other while competing. This can be considered as self-criticism for the physician and clinic community. Except from this, when a health tourism is provided, it should be a from top to toe service. I mean the planning of travel, transfer from the airport, checking into hotel, arranging an accommodation of the patient. I mean we need to provide these all together as a whole. The person to come our country shall receive all health service without any problem starting from boarding the plane. We as health institutions are doing our best about the quality of the provided health service to be at a certain quality. We need to get our teams well supported, or we need to work together at some points with tourism companies that proved themselves. USTTAK is a great institution that gathered clinics, doctors, hospitals, agencies interested in health tourism together in Turkey. And there is strength in numbers, and we see that USTTAK's projects are getting better every passing day on supporting health tourism. I am really happy to be a member of USTTAK as Görkem Güven Clinic. I am in medicine sector for almost 20 years, some part in education and some part as professional life. Health is an important subject in our lives. Not only physical health, but also psychological health, wellness, feeling good, being happy. I think of all these as a part of health. To be honest, it never made me happy to struggle with hard-to-treat diseases as a general surgeon. At this point, obesity surgery has attracted my attention with its successful results and for the amazing changes on people. I wanted to dedicate myself to here. Obesity is declared as a disease by us, however it is not a situation with a developed awareness in the community. I mean, the weighted person is being introduced as someone who likes to eat. So, it has been a source of happiness to treat something that is not accepted as disease, and result in with happiness. Plastic and reconstructive surgery was my point of interest during my academic life, but it wasn't in my destiny. Actually, obesity surgery is fully a reconstructive surgery. As you know, At reconstruction, severed limbs etc. can be mended in some way. And that organ of the person gets reconstructed. Obesity surgeries are actually reconstructive surgeries. But this time we reconstruct not only one limb but all their life. If the person really wants a new life. We are here as clinic for either surgical and non-surgical treatments. I can say that obesity is what I enjoy the most to treat.